Good evening. Thank you for joining us for our monthly community meeting. I am Chief Colleen Jacobs. I hold these virtual community meetings on Facebook on the second Wednesday of each month at 6 p.m. This year, our community meetings are going inside the department to get a closer look at the different units within our police department. Tonight, we are learning all about our crisis intervention team. But first, I wanted to let you know about a new event that our community-oriented police unit is starting. Tomorrow at 9 a.m. at the Family Fitness Center here in West Valley City, you can come and play chess with some of our police officers. You don't have to know how to play. They will teach you. It's free and available to everyone over the age of 8. So if your kids need something to do during the spring break, come out and join our Castling with the Community event tomorrow morning. You can register at castle.wvcpd.com. We hope that people can come out and join us tomorrow. Now, joining me here tonight, I have Sergeant Lipscomb, Lieutenant Burke, and our social worker, Tori Yates, to talk about the crisis intervention team. So, what exactly is the crisis intervention team, and how did the team get its start?
So the crisis intervention team, Chief, consists of basically all the officers in the city. It's a requirement that you actually proposed back in 2016. A couple detectives came to you and proposed this idea, and you approved it. One of the requirements was that all the officers that come to work for this department are going to go through and do a 40-hour training on mental health. And so that is part of the crisis intervention team. All the officers are trained with that basic 40 hours. We have a tiered system, so that would be our tier 1. The lowest level, our tier 2, is going to be our what we would call our Romeo units. They receive additional training, and then they'll do an annual training as well as a refresher. And they are the officers that are on the road that will respond to any mental health crisis calls that are received in the city.
Okay. Now, I know when I implemented the program, it was pretty unique to have everyone in the department trained in CIT. Is that still the case?
Yeah, as a matter of fact, we have some new officers that we're getting ready to put together a class for them so that they get their initial 40 hours of training as well.
Great. Now, how many people are on the team? Well, we talked about that a little bit as far as it's pretty much the whole department.
Mm-hmm.
So does that mean that someone is always available to help with mental health related calls?
Yeah, so again, all the officers are trained in that initial. We have our Romeo units. They are attached to each of the shifts, and we'll have 2 Romeo units per shift that are available to respond to those calls. We also have part of the tier 3, our detectives. They are available as in an on-call status. If there's any scenarios that maybe can't be handled at that lower level, they'll be available to help guide them through their investigations.
Okay. Now, Tori, I know you do some of the training. Tell us a little bit about that 40-hour training and what it entails.
So the initial 40 hours focuses on mood disorders, thought disorders, a lot of the issues that the officers will see on scene. So we talk about bipolar, we talk about people who are depressed, we talk about a little bit about substance abuse, because a lot of those things all go hand in hand. So we give officers an opportunity for resources so that they know how to plug people into the options of where they can go to get help, how they can get help, and kind of walk them through that process.
Okay. Now, back to the response part of it. When an officer responds to a call, walk us through kind of the process of what they do to help someone who's in crisis.
So when an officer arrives on scene, the very first thing they're obviously going to want to try to do, depending on the circumstances, is they want to de-escalate the situation. Try to, what we call grounding technique, try to bring everybody down so we can evaluate and figure out what exactly is going on. Once they're able to do that and be able to communicate with that person that they're dealing with, they're going to try to guide them and get an idea of what resources they could utilize to be able to help them go through that crisis they're experiencing in that moment.
Okay, that's great. What is some helpful information for a friend or a family member that they can provide either the police or a social worker when they're calling for help for a mental health crisis situation?
Some big things that are good information for the officers to have are, you know, what diagnosis, if there is a diagnosis that person may have, so the officer can kind of better understand what's going on. If there's any medication or illicit drugs that they may have been using, to also help the officer determine like why are they responding the way they are, and then any type of triggers or hooks that may help the officer to be able to help ground that person and kind of bring them out of that crisis to be able to better guide them through it.
Now, triggers, they can work the other way too, right?
Yes.
They can also escalate it if
Exactly. That's why it's important if they know what triggers that person may have, it would be good information to help the officer kind of avoid that, so we don't escalate the situation.
right, right. Now, there's a new mental health crisis center that CIT and the other officers they'll be using. Tori, can you tell us a little bit more about that center and how it will help us do our jobs?
Yeah. So it's considered a situation. So as long as somebody doesn't have any kind of need to go to a hospital to get blood work or labs or get treatment for an injury that they may have suffered, they can go to this facility. It's in South Salt Lake. It's right on 33rd near the new Tracy Aviary. And so anybody can walk in, law enforcement can take them, EMS can take them as well. And it's someplace where they can just go kind of de-escalate, kind of relax, have some decompression time away from whatever's triggering them or whatever the crisis might be. They'll be working with social workers. They have prescribers there. So if somebody needs to get back on medications, they can assist with that. And then they'll make sure that they have enough resources when they leave to be able to continue that that process in terms of getting back on track in terms of their mental health and whatever treatment they may need.
Yeah, that's really great. This seems like a fairly new concept in how mental health is the approach is from a collaborative effort. And you know, so many times in the past, people don't know what to do, so they call 911, and now they have another resource.
Yeah.
So that's really great.
Yeah, I don't know if we'll ever get away from a police involvement, but having social workers working with law enforcement, having other resources that aren't a medical type of response are going to be really helpful for the community.
Okay, great. Now we know that people can always call 911, call the police department when they need help with a mental health crisis. But are there any other mental health resources that you can share with people who they can reach out to besides this crisis center?
Yeah, so there's 988, which is the national crisis line. It's any call that's routed there comes straight to Utah. So you'll be talking to somebody local that knows the local resources and can help point you in the right direction. There's also MCOT teams, which stands for Mobile Crisis Outreach Team. That is a social worker and a peer specialist. That's somebody who has a lived experience, so they've had their own mental health situation where they've had to go through treatment, they've had to go through medication trials, so they can really relate to the people that they're going out to talk to. And they can help also kind of make a plan in terms of what needs to happen next. They can help decide if maybe the receiving center would be a good option, if they're able to stay home, if they do maybe need to go to an ER for some reason, and kind of help facilitate all that process. It's kind of complicated sometimes for people, especially when they're in crisis, to be able to think through all of that. So that team can come out into the community, wherever the person is. We've had people meet with MCOT at McDonald's, at Starbucks, in their home, wherever. It doesn't really matter. They'll go anywhere. So that's a really good resource. And then there's a mobile app called SafeUT that anybody with a smartphone can download and chat, either call, chat, or text with a live crisis worker as well.
Okay, yeah, that really resonates, the 988 especially, because it's almost like 911, but not quite, and it's simple. It's easy for people to remember. So
And that
That's a great
started in
resource.
Utah. That concept started here with our local legislators who wanted something easier for people to remember that wasn't a long 10-digit number. And so our local legislators actually decided to come up with that concept and then worked with the federal government to take it nationwide. So not just Utah, but we actually helped the whole country on that side.
That's great. Now, so getting a little personal, what makes you want to do this work, Tori?
That's a big question. Mostly because I like helping people. I like the crisis side of things. Social work is a very broad category, so you can do therapy, you can do a lot of different things. But I like being able to help people when they're having a really difficult time. And crisis is kind of like an ER setting, so it's very fast paced. But being able to identify what's going on with somebody, identify what would help, and then facilitate getting them to that help is really rewarding. So.
Okay. What about you? What's the rewarding part of the CIT for you in your position?
I think the biggest thing is, as an officer, when we're responding out to these calls and we start interacting with somebody, and the immediate idea is that we're there to investigate like a crime. But with the training that we receive and interacting with the officers, and we all have our life experiences as well to be able to use that and to go into that investigation and say, okay, well, maybe there's something more than just a crime was committed here. Maybe this person is experiencing a crisis, and having that knowledge to be able to help them go through that and get guidance to be able to cope with it, or kind of to process that and have a resource at the end to be able to help them get through that down the road is really a good feeling to be able to help them with that.
Yeah, that's great. Now, Lieutenant Burke, you've been around for a while.
Day or two.
Do you have any instances of someone in crisis where you were able to help that stick out in your mind?
Gosh. Yeah, I have quite a few actually. When this first started, I kind of helped bring it to the city. When the two detectives that went to the original training brought it to me, and as one of them said, I tied the red tape around it for the administration. We just changed the policies around, or the proposed policies around a little bit to make them make more sense. I worked with the fire department to try to help our policies match, because it seemed like their policy pointed at us for the solution and our policy pointed to them. And I found out that their paramedics only get maybe 10 hours of training at the most, where we're getting 40 right out of we're getting more than that at our basic police academy, but most of the agencies there now have some sort of a crisis intervention system, and we're all getting 40 hours of training as soon as we get hired, or as soon as you were able to get into a class. Over the years, I've seen, I remember one night a kid was having some sort of a crisis, and he's throwing stuff out the windows, destroying the house, and you kind of wonder how you help these people. And noticing through kind of, I guess, tying the red tape around it, we did see that there's some significant gaps in the mental health system. And I love the resource center, or the receiving center, because that closes a big gap. A lot of times people will call and nobody knows what to do. So that's where we kind of had to learn what to do. And yes, it's not a law enforcement problem, it's a mental or medical problem, and it just kind of got thrown in our laps because of the way the statutes are written. So I enjoyed seeing this whole thing evolve into what it is today, and the good work that we're doing for people to try to de-escalate these situations and put them in touch with a provider so that they can get back on their meds and get back to being as functioning as normally as possible.
Yeah, we really have come a long way.
And I think a lot of people that are in that crisis, no matter what condition it's in, they don't know what a normal is, and unless they have some sort of help. And getting people in touch with that help is very important, and that's one of the things that I like to do. Is I enjoyed seeing that happen.
Great. Yeah. Well, I hear my phone going off, so it tells me we've got some questions from Facebook. Let me see what we've got here. Amber asks, are there resources for autistic children and adults?
There's not as many for adults, unfortunately, but we're getting better with that. There are clinics that are going to be opening up soon if they're not already open in the IHC system, so Intermountain Healthcare, as well as the University of Utah. They're both kind of the primary locations for a lot of resources for people who are on the spectrum. There's also, if the youth is still in school, there's the Spectrum Academy. There's a few treatment programs, but they're up in Davis County as well. But they're all run through IHC.
Okay. All right. And then the next question is about elderly parents or those with dementia. What resources are available for folks in that situation?
One of the best resources, especially for caregivers, because that's a huge burden on, not really a burden, but it's a huge difficulty sometimes for people who are the caregivers, would be through Salt Lake County Aging Services. They have a lot of support groups. They also have a lot of connections with respite care for families who are taking care of their loved one in their home, to be able to give everybody a little bit of a break, a little bit of a breather, but also to give some evaluation as well in terms of maybe mom or dad needs a little bit more care. It can help facilitate some of those things.
Okay. Then we've got another question here about resources available for family members or people experiencing a mental health crisis kind of in the moment.
In the moment, depending on the situation, I mean, if it's something that's dangerous, I would say police are really your best option. We need to make sure everybody's safe. But if it's something where it's just mental health and somebody just needs somebody to talk to, 988, MCOT. If you can safely get them over to the crisis care center, those are all really great alternatives to the police response.
Okay, great. Let's see. Erin, do we have any additional questions coming in? Perfect. To the three of you, is there anything else that you think the community should know about our crisis intervention team?
I would just say that they are a good resource. I know we show up in a uniform, and that's kind of hard for people to call the police. But our guys have quite a bit of training in handling those things, and if they can kind of bear with the uniform, I guess. Our guys do have big hearts, and they do want to help.
Yeah, you mentioned the uniform. I remember when we were getting the program up and going, that was one of the things that was different, is the CIT officers were in a different uniform.
A little softer, a little more approachable. And I kind of like that we did that, because I think that did its job.
Yeah, and now they have a CIT distinguisher on their uniform, and I think with as much as crisis intervention has been in the public eye, it really helps both family. Well, I don't know if it really helps person in crisis, but it helps family and friends and other people who are around identify that the officer has the training and the skills and ability to help with that situation.
We're lucky we get people that actually request a CIT officer. I think that they've been in it for a little while, that they realize that the resources out there for them, and that we're going to show up with one of our tier 2 guys, or even one of our tier 1 guys that are going to have a little more training and might be able to handle the situation a little bit better than those agencies that don't do that.
Right. Okay, great. Well, that'll do it for this evening. So thank you for joining us this evening. And our next community meeting will be Wednesday, May 14th, and we'll be talking about the Honor Guard. Thank you and have a good night.